Good afternoon, all of you. So just I'm going to the brief overview of the cystic fibrosis, which is one of the common genetic disorder, one of the rare diseases, which is quite common in this area, but somehow it has been not picked up or maybe missing somehow. So I will talking about in a brief, what is cystic fibrosis, what is their prevalence in Rajasthan as well as in India, what is the genetics, and how can make a diagnosis. And lastly, I will talk about the challenge in the management of cystic fibrosis. So cystic fibrosis is a most common life-limiting inherited disorder in Caucasian populations in a Western country, and it is a multi-system disorder. The most common organ involved is the lungs, pancreas, and skin, what we see commonly, but it can involve any part of the body, like the reproductive organ. Usually the female are usually sterile, and the male are also infantile. Likewise, also bone, like diabetes. So it can involve any organ system. And the presentation of cystic fibrosis also depend upon the age. If you take in the neonatal period, the child may present with a meconium ileus, that is the not passing stool in the first 7 days, and get the abdominal swellings. And you just cross by the adolescent and adulthood, you may get one of the complication of the cystic fibrosis, like the cystic fibrosis related diabetes. So it has a very wide manifestation depending upon the age group. But in India, the study have seen that the most common presentation of recurrent or persistent pneumonia, which has been seen in about 98% of the cases. Malabsorption, that is, the children usually present with a large, bulky and fatty stool. We often ask, कि क्या लैट्रिन में तेल आता है, क्या बदबू आता है, क्या है ना, you used to ask. So this is the most common, one of the most common manifestation, and obviously due to the recurrent infection and as well as the malabsorption, child usually not able to grow normally, that is the failure to thrive. These three manifest, there are two series from the PGI and one from the AIIMS New Delhi have shown that these are three are the most common presentation in India. Next, moving to the what is the prevalence of this disease globally as well as in India. If you go through this chart, it is reported from throughout the world. It is more common in the Caucasian population, as you can see in a very rate, that is from the USA and the part of the Europe. The rest of the world having some incidence of the prevalence of the cystic fibrosis. Initially, it has been thought that cystic fibrosis does not exist in India, but gradually, since the first case report of the cystic fibrosis in 1968, you can see through this map that most of the states have one or two reported cases of the cystic fibrosis. And one study, Dr. Serum, it is quite large. It is going beyond that. So one study from the AIIMS Delhi, they have done in a cord blood sample in 990 newborn children, and they have estimated the incidence of cystic fibrosis in India, which come to from the 1:10,000 to about 1:40,000 per live birth. It may be much more, but this is just estimated based on the cord blood sample, based on the carrier. If you ask me what is the prevalence in Rajasthan, the answer I don't know. But what I can tell you, the burden of whatever we are seeing, the cystic fibrosis of AIIMS Jodhpur. We have till December 2024, I have 57 cases of cystic fibrosis. And you can see through the map of the Rajasthan, we have referral cases from almost all the district of the Rajasthan, major district of the Rajasthan. And so it is not so less common. So if you see you see this common presentation, then you need to suspect then and need to diagnose then cystic fibrosis. Another is that obviously most diseases, it is also most commonly male has been reported in our series, about 37 were male and 20. What I want to emphasize, the most interesting thing is that usually the cystic fibrosis present in a later childhood, but because of the development of cystic fibrosis services at our center, now we are able to pick up children in less than 1 year of child. And you can see now most of the children at our center is pick up by the 1 year. And so about 33%, 1/3 of the population are less than 1 year. And it is very good. Once you recognize the disease at very early age, you can give the treatment very obviously in a systemic manner, and that we have the very good result. And this is the trend of cystic fibrosis presentation at AIIMS Jodhpur. We have started from the 2016 and now it is 2024. This is about 57 cases in our AIIMS Jodhpur. Now, As you all know, the gene for the cystic fibrosis is located at the long arm of the 7th chromosome, and it about 1480 amino consists of it 1480 amino acids. And what it do, it actually controls the chloride channel into the body. It controls the movement of the chloride from the inside of the body to the luminal surface, and so it controls the movement of the water into the luminal surface. And so the secretion of the secretion in the luminal surface, like in the respiratory tract, intestine, and other skin, pancreas, they maintain the normal viscosity of the circulation, and this is very important for the functional of the vital organ. In cystic fibrosis, this is CFTR, that is the cystic fibrosis transmembrane conductors. This is the CFTR protein. It is actually work as a chloride channel, and due to defect in this chloride channels, chloride ion cannot move from the inside of the body to the luminal surface. So the secretion become very viscid, very thick. So the mucociliary action get impaired, and it causes the impairment. Frequent blockage of the airway, frequent blockage of the pancreatic duct, and called frequent infection. You can see here, this is the normal airway, and the children with the cystic fibrosis, the whole air get clogged with a very thick and viscid secretion, and which lead to the further infection as well as the damage of the airway. Now, inheritance pattern, I know you all must be aware, this is the autosomal recessive pattern. It is very important to understand this. This is very important during the counseling, antenatal counseling, or maybe the genetics counseling for the children. Based on the site of location, there are different genetic mutations for this from 1 to 6. What I want to emphasize that the clinical presentation of cystic fibrosis will depend upon the severity of the mutation. The mutation class 1 to 3 have a very severe manifestation, while the mutation in a 4 to 6 are very minor manifestation. So it is very important to know about the type of mutation in cystic fibrosis. In a Western country, it is the most common mutation in the homozygous delta 508 mutation. But in India, recently we have done the multi-site study for the cystic fibrosis from the India, and we try to know that it about the 99 to 44% of the population of the cystic fibrosis just have the delta 508 mutation, and rest have the very rare mutation, 1 or 2 mutations. So this is very interesting from the Indian part of the cystic fibrosis. Now, diagnosis, how we make the diagnosis? First of all, on the clinical suspicion, the child have the recurrent or persistent pneumonia, feature of malabsorption, that is the fat malabsorption, and having failure to thrive. Then we do the sweat chloride. Sweat chloride, it is more than 60, it is positive, 40 to 60, it is equivocal, and less than 40 is less common. Mutational analysis we can do. The problem is that there are more than 2,000 mutations is known till now, or maybe many are not known. So if you just do the diagnosis based on the mutational analysis, you may miss some of the children with the cystic fibrosis. So this is not the primary method of the diagnosing cystic fibrosis. And sweat chloride is a just method. Here we apply a this is the advanced sweat chloride collecting system which is available in a Western country, which is known as macro-duct system. But the problem is that this is very costly. One test required 4,000 to 500,000 rupees, and the machine equipment itself cost about 20 to 30 lakhs rupees. And because the disease is rare, we cannot perform daily basis, so it is very costly in our setting. So at AIMS New Delhi, there is equipment has been developed which costs just only less than 1,000. What we do, we put just pilocarpine on the one volar surface of the forearm, then a positive minimum electrode. We give the positive current, and then after half an hour, we collect the sweat from that area. And then we do the analysis, chloride analysis from that collected sweat. And if it is more than 60, then it is positive. And based on this method, we also developed here the sweat chloride method. And on the same method, we also do the sweat chloride estimation at our center. And one thing I again want to emphasize that sweat chloride is the gold standard for the diagnosis of cystic fibrosis. You may miss just if you send the genetic analysis, you may get the negative result, but you are very much sure about the clinical presentation. You should have done the sweat chloride test. Yes, this is a very new test has been come from the study from the AIMS New Delhi, and what they found that a child with the cystic fibrosis, when they play in the water, their wrinkling of the skin occur very smooth. And based on this observation, they did a randomized control trial, and what they found, the infant with the cystic fibrosis, they develop the wrinkling of the skin within 3 minutes. And with this method, they found that there's sensitivity about the 81% and a specificity of about the 57%. So even if you don't have any facility for the cystic fibrosis, you have suspected based on the clinical presentation, what you have to do, you have to put just one hand into the RO water for 1 minute, and 1 minute just remove the water and match with another hand whether the wrinkling is developed or not developed. If developed, then you mark the timing. If not developed, again put into that. So do 1 minute, 1 minute. If it is wrinkling come into the 3 minutes, then it is obviously favoring towards the cystic fibrosis. So this is the very good and cause no any cost, because you just require the RO water. And this is a very good screening test, because again in a large database we have again tried to validate this and again come to the sensitivity about 80 to 90%. So this is a very good screening test going to in India. Another thing which I want to highlight, the neonatal screening, which are again in a very nascent stage in India, but in a Western country, most of the European and USA country, now the diagnosis of cystic fibrosis is depend upon the neonatal screening, that is by the immunoreactive typsinosis. But in India, we usually perform in those children which having the history of cystic fibrosis. In those infants only we perform it, because it is costly and also not very much sensitive as well. So immunoreactive typsinosis is the name. One thing I again want to emphasize that this is just a screening test. It is not a test for the diagnosis of cystic fibrosis, because we get many children coming with this report and labeling as a diagnosis of cystic fibrosis. So again, this is just a screening test and it has no role beyond the neonatal period, because it has only role in a screening of cystic fibrosis in neonatal period. Beyond that, it has no role. Management, now we have just supportive management like the airway clearance, pancreatic enzyme replacement. This is very interesting one, because pancreas is not working, so we need to give a capsule, and in capsule itself there is a lot of microaspirants. We have to give these capsules as a whole to work into the duodenum, because it works only at the alkaline pH. So this medication should be given as a whole, and this is one of the very not costly, but it is a costly medication for the parents. Likewise, we have to give the vitamins like the fat and water soluble vitamin, mineral supplementation and treatment for the individual infection, nutrition support, and screening and management of complication, which one or another complication children usually develop, which are not going to discuss here. But if you give the supportive therapy, depending upon the age of child, again it costs about 5,000 to 10,000 rupees per month. So again, it is even the supportive therapy is very costly for the children. But ultimately, even you give the best supportive therapy, children usually develop the end-stage liver disease and child die by the age of the 17 year. What with the Indian data so that the median age of survival is 17 year. But the good thing is that in a world, in a Western country, newer therapy has developed in last 1 decade, and which is very, very effective. This first drug is developed into the 2012, that is the Calideco, and then again in 2015, another drug Orkambi developed. Another in 2019, Simdeco is developed, and latest in 2019, Trikepta is developed. And this drug have changed the pattern and the survival of the cystic fibrosis. You can see here, this is the latest Cystic Fibrosis Foundation, that is the highest society for the cystic fibrosis from the USA. It has been shown that till 2013, the survival is just 39 years. And after the introduction of the CFTR modulator therapy, the survival becomes 61 years. So this is a very, very effective. Apart from that, if you see the lung transplantation data, beyond 2080, it is about 259. But after starting the therapy, the lung transplantation becomes very much reduced. Requirement becomes 61 from it is less than 1/3. So these data show that this drug is very effective in a Western country. But the problem is that this medication is very costly, and also this medication are not accessible in a legal way into the India. Currently the problem we are facing for there. The current change in the CF management, though supportive treatment is improve the quality of life, but ultimately child develop the end-stage liver disease, bronchiectasis and respiratory failure, and child usually succumb by the age of the 17, 18 year. I have maximum 21 years. Last year the child died with a 21 year. And still supportive therapy is costly for most of the Indian family children, like the 4,000 to 10,000 rupees is very costly. But it is very thanks to the government of India who has started this Center of Excellence Rare Disease Program, which is now supporting this supportive medication for last 1 year, which is very, very helpful for the most of the family. Regarding the CFTR modulator therapy, it is not accessible in India, and also it is very costly. It costs about, I have started in two children in the CFTR modulator therapy, by the some illegal route, or you can say by the some other way. And it costs about $10,000 per month. And if you take the data from the 1 year, it will cost about 1 crore rupees per year for a one child. So it is very costly and beyond the coverage of the rare disease program also. So though the drug is very effective, but it is not available in India, and also it is very costly for the timing. The key point from this presentation, what I wanted to emphasize that cystic fibrosis is a multi-system disease. However, in India, the most common presentation is recurrent pneumonia, malabsorption, and failure to thrive. Whenever you see this three combination, triad of combination, must suspect cystic fibrosis. Another combination, another type of the symptom we see in our practice is the pseudo-water syndrome, the loss of the dehydration and the electrolyte loss like the hyponatremia, hypokalemia. And this is quite common in our Rajasthan because of the very high temperature during the summer season. The children usually have the dehydration and loss of electrolyte without any vomiting and loose motion. This is known as pseudo-water syndrome, and which is one of the very characteristic manifestation of cystic fibrosis. Second, that is not rare, not so much rare in India. It is quite common if we pick clinically. It is quite common in India as well, and in Rajasthan as well. We are missing somewhere because we are not picking at this disease commonly. Platelet collect is a gold standard test for the diagnosis of cystic fibrosis. If you just rely on the mutational analysis, there may be chances of missing. If it is coming positive, then it is good. If it is not positive, you may be missing some of the children with the cystic fibrosis. And aquagenic wrinkles is a very emerging new scanning test for the cystic fibrosis, which costs nothing, just 0 rupees to do it. You have to just do in a clinical suspicion of CF, and you have to do that. Currently, supportive therapy is the mainstay of the therapy. And we need to work together to make availability of this CFTR modulator therapy in India, so that we can also improve the quality of life of cystic fibrosis children in India. This is just a cystic fibrosis meet we did in last year in this room only, and we give just education to the children and parents. Thank you very much.